Glad you could make the time for us today. Welcome to the program. This is Health and Lifestyle. My name is Marie Yambo. As usual, our social media handles at Marie Yambo, at KBC Channel 1 on X, KBC Channel 1 TV on Facebook. We are also on YouTube. Well, coming up in this program.
So when I cough, I have a leak. When I do some simple calls, I have a leak.
A weak pelvic floor. Ruth's journey with urinary incontinence.
The pelvic floor gives stability to the body and especially to the trunk.
And Mulenge shares some exercises to treat pelvic floor dysfunctions. And preventing pelvic floor dysfunction, tips on our good practice segment. First on the program, Ruth's life was unexpectedly disrupted by a condition that many find difficult to discuss, and that is urinary incontinence. Well, after months of struggling with a weak pelvic floor, Ruth faced challenges with daily activities like social outings and even her overall confidence, as simple actions like laughing, coughing, or even lifting became a source of anxiety as she coped with the unpredictable effects of urine incontinence. Here is her story. Ruth Modoka, a mother of 3, has been attending physiotherapy to correct a pelvic floor disorder. Like many others, she struggled with urinary incontinence, a condition in which there is a loss of bladder control. While it affects older adults, both men and women, for women, childbirth can be a risk factor.
My first girl I got through normal delivery. That she is now 8 years old. The second one I got through CS. She was 29 weeks, so I went through CS. And then she was put in incubator for 49 days. After that, I had the third girl. She is now 3 years. So I got her also through CS. After that, it's when I realized I have a pelvic floor problem. I started leaking. After, let's say, like 2 months, the baby was big, so I think she also early in my pelvic because she was around 4.9.
Often unspoken, urinary incontinence impacted every aspect of her life.
So when I cough, I have a leak. When I do some simple calls, I have a leak. So I worried what is happening. But I had to go out, kama ni shopping. But I used to put on pads. Kama ni kulala, I make sure nimevaa pia pad. Yeah.
Yet, like many, she at first kept her condition a secret before opening up to a friend.
I had to open up because the first 2 I had no problem. So this was a new thing to me. Every time I cough a little, it leaked. So I had to open up to that friend of mine. So after opening, I knew also she had the same problem.
But there are treatments that can help, from lifestyle changes, physical therapy, and, in some cases, surgery.
At home, I had to do some exercise. Then when I come, then there are other exercise she do to me. It was helpful because after a month, I had to see change. So I was treated for 3 months and I was okay. Kabisa. In a month's time, I had to see some changes. So I was in therapy for 3 months and I was okay.
Through a combination of pelvic floor exercises, Ruth's symptoms began to improve.
The exercise, I had to do them seriously, not to lift heavy things. So I had even sitting position.
According to Ruth, there is need for public awareness about this condition.
Most of them, they don't have the information. They may think it is a normal thing. And they stay with it later, it will prolong to a big problem that they could have solved it earlier.
Well, it looks like a normal thing, but it can also cause a lot of discomfort for many. So if you or someone you know is struggling with urinary incontinence, know that help is available. And now to the word on the street, we just wanted to know whether people are aware about urinary incontinence and even how they manage to deal with it.
Sometimes kenye kinatuma hali kama hiyo inakuja nikiwa kazini, ile sehemu haina sehemu ya kujisaidia, so ninakaza ile mkojo sana, ninakaa for long kama masaa mengi bila kwenda kujisaidia. So ile masaa nitaweza kutoka, ninakuwa nimekazwa kabisa. So nikirudi tena ninasikia mkojo ikinishika kidogo, inatoka kwa haraka because nilikaza sana kwa muda. Nikashindwa kuzuia kuitoa kwa muda sahihi unaotakiwa.
Sijai experience hiyo, but nilisikia rafiki yangu akisema ashai experience kitu kama hiyo. Ile time anataka kuenda haja, yani hakuna vile anaweza yani inatoka tu, yani inakuja tu. But mimi sijai experience kitu kama hiyo.
Okay, I used to see some of my friends taking drugs. Some were using like things to stop, like they were using, let's say, something like pads. There are these, should I call them pampers for the adults? They do wear them, so at least it helps them not to destroy their clothes. Yeah.
And on that note, we take a break, but when we come back, we'll be looking at some of the exercises that you can do to strengthen the pelvic floor. Thank you for staying with us. A weak pelvic floor may affect lots of women, but men too can suffer this condition. Anne Mulinge is a physiotherapist who has made it her mission to help people regain control over their lives by addressing urinary incontinence. Let's hear more from her.
So the pelvic floor basically is the muscle that you are sitting on, or the muscle that we sit on. The muscle that we use to pee. Peeing is urinating, or the muscles that we use to poop. Any muscle around there, just below your navel or below your umbilicus until your back. All those muscles, that's what we call the pelvic floor muscle. So there are different conditions that affect the pelvic floor, very many conditions. And one very key condition that affects the pelvic floor is urinary incontinence. Another is prolapse. When we are talking about urine incontinence, we are talking about 2 or 3 types of incontinences, which includes stress incontinence, urgent incontinence, and mixed incontinence. When you're talking about stress incontinence is when someone is leaking urine when they cough, when they lift, or when they do any activity that exerts the pelvic floor. When you're talking about the urgent incontinence is when a patient is not able to get to the bathroom before they leak urine. So by the time they are running to the bathroom, urine has already leaked. The mixed incontinence is when it comes both the urgent incontinence and the stress incontinence. Someone has leakage with coughing and lifting, and at the same time, they're not able to reach the bathroom for a bowel movement.
Okay, so you've also talked about a prolapse, and in layman's language, how would you explain what a prolapse is?
Okay, a prolapse is when we have weakness of the muscle resulting into the organs of the pelvic floor coming out. For an example, when we talk about the uterine prolapse, it is when the uterus, in simple terms, comes out. It's not being held by anything, or the muscles have become too weak that they are not able to hold the uterus inside. So the uterus comes out. When you talk about rectal prolapse is when the muscles of the rectum or the muscles around the rectum, they are not able to hold the rectum into position, and the rectum just comes out.
Yes, and so like you've rightfully explained that the pelvic floor muscles, when they're weak, they can actually be affected by so many other conditions. One of them is urine incontinence. And this affects women most of the time. Could you explain to us why that happens?
With urine incontinence, both the urge and stress incontinence is more popular or common in women because, one, as women, we go through childbirth and pregnancy, and one of the commonest causes of urine incontinence is pregnancy, childbirth, and aging.
Like you've said, that urine incontinence is as a result of the weakness of the pelvic floor, and you've talked about women being, mostly affected simply because of childbirth. But is this just childbirth, or is it multiple childbirth, or does it even matter the weight of the baby, during delivery?
With urine incontinence, when a mother is pregnant, there's a lot of pressure that is in the pelvic floor because the weight of the baby is lying directly to the pelvic floor. So the baby, or the weight of the baby, pushes the pelvic floor and it makes it weak. Remember, this is a mother also who is going through daily activities of living. So as she does her daily activities of living, she's still exerting pressure to the pelvic floor. And probably pre-pregnancy, she had not conditioned her pelvic floor muscles to be ready to take a pregnancy. And when they have a big baby, maybe the baby in the uterus is big, more than 3.5 kilos to 3.7, 4 kilos baby, it will give a lot of pressure to the pelvic floor muscles, and that will make the pelvic floor muscles weak and hence result into urine incontinence.
So you've talked about the pelvic muscle becoming weak, and that is what helps us in terms of, being able to hold your bladder, if I may call it. But when it comes to urine incontinence, then it means that the pelvic floor muscles are weak, and that is affecting your bladder or something of that sort. So maybe you could explain to us deeper to understand how, can I say, your bladder and the pelvic floor are connected?
We understand that there are different functions or role of the pelvic floor muscle. One of the biggest role of the pelvic floor muscle is stability. The pelvic floor gives stability to the body and especially to the trunk. The second thing is the pelvic floor really helps in breathing. The pelvic floor really helps, or a big role of the pelvic floor is during childbirth, to help in relaxation and contraction of the muscle to allow the head of the fetus to come out. The other thing that is, the other role of the pelvic floor is for sexual satisfaction. So when this mother has a pregnancy, she's pregnant, and probably the weight of her child is big. She's carrying two babies, which you call a multiple pregnancy, or she has had a child following each other closely. We know that the pelvic floor muscle has not yet recovered, so you find they are still weak, and this will lead to the muscles being weak and leading to pelvic floor dysfunction that will result to urine incontinence or fecal incontinence.
So there's the notion that a weak pelvic floor is a woman's problem, or a woman's problem for that matter. But men can also get the condition. Maybe you could explain to us some of the conditions that can affect men in terms of a weak pelvic floor muscle.
Pelvic floor dysfunctions, they are not a woman thing. Even though it's majority of the people or the majority of the population that get pelvic floor problems, they are women, but it's not a woman thing because we have erectile dysfunction in men. Men also go through erectile dysfunction. Men also go through constipation. Men also go through the neuralgias that women go through. Probably a man has been done surgery, and this affects the pelvic floor muscle that he has. So pelvic floor dysfunctions or disorders are not a woman thing. They also affect men as much as they affect women.
So what are some of the symptoms that people should look out for in as far as weak pelvic floor muscle is concerned?
Okay. So some of the symptoms of a pelvic floor dysfunction is, number one, when you're leaking urine, that is a pelvic floor dysfunction. Another symptom is when you have pain in your pelvis. Probably you can be going through constipation, or you're going through fecal incontinence, or you're going through fecal seepage. Fecal seepage where you go into the bathroom, you wipe yourself and your tissue remains with some poop. Those are symptoms that you should be careful to check on when you suspect that you have a pelvic floor problem. Some treatment options. Number one is when you have a pelvic floor dysfunction, you're leaking urine, you have constipation, you have neuralgia, you cannot feel yourself when you go to the bathroom, please see a physiotherapist. Pelvic floor physical therapists, we are very few in Kenya. Like we are not 20. We are very few. So if you are not able to reach a pelvic floor therapist, please reach a physiotherapist. And a physiotherapist will be able to give you some good attention before you reach to us as specialists. Yes. So another treatment option is if it is something that is more than meets the eye for me as a pelvic floor therapist, I'll definitely refer you to a gynecologist for them to assess you and advise. Another treatment option is probably if you have like a prolapse and it is more of it's a bigger prolapse that we cannot work on as pelvic floor therapists, you can definitely get a surgery for it.
So last but not least, these are very private matters. People are not very free to talk about them to anybody. And there are also symptoms that people can be going through that they might think like they're normal. Maybe you could explain to us that and what would be your message to the people out there?
Yeah, so sometimes people would ignore a pelvic floor condition because it's a shameful thing to talk about. It's a shameful thing to say, I'm leaking urine. It's a shameful thing to say, I'm not able to have a sexual interaction with my spouse. People feel like they are not in that space to talk about their intimate selves. What I can encourage our viewers and our patients is do not feel shame. Find someone who you can talk to, you can trust, explain, and open up to them. Another thing is if your pelvic floor condition will remain untreated because you've not spoke about it, we risk having infections, chronic infections. We risk having colon issues. We risk having chronic constipations. We risk having many other things that you could have prevented if you had sought help earlier. So please don't feel shame. Don't feel like you're having a condition that people do not have. When you're smelling or when you're feeling like you smell urine, do not feel ashamed. Please seek help. Find someone, disclose, open up, and you'll find help because we are available.
So someone listening to this will also ask the question, because fistula presents itself more or less like a weak pelvic floor muscle when it comes to urine incontinence. So what would be then the difference between fistula and a weak pelvic floor that causes incontinence?
Okay. Pelvic floor dysfunction or weakness and fistula is one thing. Because fistula is a condition of the pelvic floor as a result of the pelvic floor being weak. Okay? As a result of the pelvic floor having a problem, that's how a fistula will come. For an example, you are pregnant and you're carrying a heavy baby. And during labor, you have a prolonged labor. So when the doctors are helping you deliver, they do something that you call episiotomy. And you don't heal well, the episiotomies don't heal well, that is how a fistula will come. Or other mothers will deliver in the village and they do not have someone to take care of them and check whether they got a tear or not. So when you have a tear and the tear is not taken care of, that is how a fistula will come.
As you've heard, urinary incontinence doesn't just affect women, men too are at risk. So look out for their symptoms, and if any, you can actually seek medical advice. And on that note, let's look at the good practice. You've likely heard of the Kegel exercises. This squeeze and hold exercise, developed by Dr. Arnold Kegel in the 1940s, was designed to target the pelvic floor area. Now, pelvic floor muscles are under a lot of strain during pregnancy and childbirth, and women who experience symptoms of pelvic floor disorders during pregnancy should seek treatment to prevent further complications. In addition, lifestyle modifications such as regular exercises, a healthy diet, and proper management of chronic constipation can help reduce the risk of pelvic floor disorders. Being overweight can weaken the pelvic floor muscles and cause incontinence, so losing weight can also improve or eliminate symptoms. And if you or someone you know struggles with urinary incontinence, know that there is help available. You can also talk to your healthcare provider. That's where we come to the end of the program today, and on behalf of everyone who made this program possible, including Anne Molinge, the physiotherapist, and also Ruth Mudoka for sharing her story, we say thank you for your time. As usual, if you've missed any part of this program, do not shy away, but do go to our YouTube channel and you can be able to catch up with the whole program. My name is Marie Yambo and hope to see you again next time.